You hear the sirens. Inside that ambulance, a first responder is in a flat-out race against the clock, trying to save someone from what they call a brain attack. Today, we're going to pull back the curtain and deconstruct the exact protocol they use to spot a severe stroke and why every single second is just so critical. All right, let's get into it. So, here's our roadmap. We'll start with what a brain attack actually is. Then, we'll talk about the race for information. After that, we'll spend most of our time breaking down the VAN assessment. We'll see what triggers a stroke alert and wrap up with what all of this means for you.
Okay, first things first. Let's really frame what we're talking about here. A stroke isn't just some medical event, it's a full-on emergency happening inside the brain where the clock is your absolute worst enemy. To put it simply, a stroke is an injury to the brain because its blood supply gets cut off. It's kind of like a heart attack, but it's happening to the brain. And here's the scary part. Brain cells start dying within minutes. That's why treatment is so time sensitive. The quicker a patient gets care, the better their chances are.
Now check this out. Before a paramedic even lays a hand on the patient, their first job is actually a race for information. And what they find out in these first few seconds can change the entire outcome.
So, it all boils down to this one piece of information, the last known well time. What does that mean? It's the exact time the person was last seen acting completely normal. Why is that so important? Because this single fact helps the hospital team decide if the patient can get these powerful, clot-busting drugs called thrombolytics. These things can literally reverse the effects of certain strokes, but, and this is a big but, they have to be given in a super narrow window. We're talking just a few hours. Okay, so if you ever find yourself in this situation, this is what you need to know. First, that last known well time, absolutely critical. Second, have a list of their important medications ready. And third, a contact number for family or a friend. Now, just as important is what not to do. Do not, under any circumstances, give them anything to eat or drink. Stroke patients are at a huge risk of choking, so that's a big no-no.
All right, let's get to the real heart of this protocol. Paramedics use this simple but incredibly powerful screening tool called VAN. It's a quick way to check for the big signs of a severe stroke, and it stands for vision, aphasia, and neglect. So first up, V is for vision. The paramedic isn't just checking if the person can see. No, they're looking for very specific problems that can point directly to the part of the brain that's in trouble. The test itself looks really basic, but it tells them a ton. The medic will hold up a few fingers on each side to check the patient's peripheral vision. Then, they'll have them look from side to side to see if the brain is controlling the eye movements correctly. Two different functions being tested right there. The first big question is about their field of view. Can they see what's happening on both sides? If the answer is no, that can mean part of their vision is just gone. That's a huge red flag.
The second question is all about coordination. Are both eyes moving together like they should? If they're not in sync, that points straight to a problem in the brain. Any no so far is a major concern.
Okay, let's move on to the A and see how this all connects. A stands for aphasia. It's kind of a catch-all term for having trouble with language, either getting words out or understanding what's being said.
So how do they test for this? It's incredibly straightforward. The paramedic will hold up two really common, everyday objects, like a pen and maybe their own shirt, and just ask the person to name them. Now that sounds super easy, right? But for someone having a severe stroke, that connection between seeing an object and then finding the right word for it can be completely broken. So if they can't do it, if the answer is no, that's another critical clue. And that brings us to the final letter, N for neglect. Now this isn't what it sounds like. It's a really strange and fascinating neurological thing where the brain literally starts ignoring one entire side of the body or the space around it.
So the paramedic checks for neglect in three different ways. They see if the patient's eyes can track an object all the way across their field of vision. They test to see if the patient can feel being touched on both arms at the same time. And they just kind of observe. Is the person generally aware of both sides of their body? First up, the eye tracking. Can their eyes follow a finger smoothly from left to right and back again? If their gaze seems to get stuck on one side, that's a big sign of neglect. Next is a sensory test. This one's wild. With their eyes closed, the medic touches both of their arms, but if the patient says they only feel it on one side, that means their brain is literally neglecting the feeling from the other arm. And the final check is really just an overall observation. Does the patient seem totally unaware of anything happening on their left side or their right side? A no to any of these neglect questions pretty much completes the VAN assessment. So, all these yes or no questions, what do they all add up to? Well, this is where everything clicks into place and leads to probably the most important call a paramedic can make from their ambulance.
The rule is just beautifully simple. If the answer to any single one of those questions in the vision, aphasia, or neglect tests is no, boom, the paramedic immediately gets on the radio to the hospital and declares a stroke alert. That one call sets an entire expert stroke team at the hospital into motion before the ambulance even pulls in.
Look, understanding this protocol isn't just for kicks. It actually puts you, the bystander, directly into what's called the chain of survival. Knowing what's happening and why can absolutely make a life or death difference.
So, what's the big takeaway here? What should you remember from all this? First, know those signs: problems with vision, language, or one-sided neglect. Second, you have to act fast. Call for help the second you think something's wrong. And third, be ready with that crucial information, especially that last known well time, to give the EMS crew a massive head start.
Remember, time is brain. Every second that ticks by, more brain cells are lost. The actions of first responders are fast and precise for a reason. But that chain of survival, it almost always starts with a bystander, a friend, a family member. It starts with you. So now that you've seen the protocol, the only question is, could you be the one to help save a life?